So today's topic was 5 simple steps by which you should choose your doctor. So let me just tell you one by one. First of all, if you want to get your hair transplant done, because you are special, so your doctor must be special in the sense they should be well qualified. They should know their job. Now, what are the different criteria by Government of India which make your doctor well qualified? Either they should be plastic surgeons or they should be dermatologists, or according to the Association of Hair Restoration Surgeons of India, they should be American Board Certified Hair Transplant Surgeons. So these are the different criteria which should help you in choosing your doctor. Because these are those people who know their job. Also, you see that if there are any additional degrees to it, like if your doctor is a gold medalist in plastic cosmetic surgery, it is cherry to the cake. Secondly, if they are members of different international and national organizations like International Society of Hair Restoration Surgery, then Indian Society and Asian Society, so on, so well. So this means that they are even more, they are honing their skills, going to different international gatherings, finding out more about what is new in the field, what are the different challenges doctors are facing in this field, different points where there are patients who are posing different challenges, how to tackle them. So the more they learn, the better. It's so much better for you. Also, what is the experience, their experience in this field? If they are doing their job nicely, this will be shown to you by the testimonials. You can find a trail of testimonials on the internet, and you can also ask them if you want to see different cases, what good results they have produced in the past years. So by experience I mean not of months or days, but it should be years together. So because hair transplant is something which has a long learning curve. If somebody is giving steady results for a good number of years, it means they are doing something right. So good experienced doctors, like here we are 2 ABHRS certified doctors, American Board Certified Hair Transplant Surgeons, and the center we are running is doing hair transplant surgeries, FUT and FUE and body and everything, right since 2009. Speaking of this brings me to the third point. They should be, when you go to consultation, when you go for consultation for your hair transplant surgery, the doctor should have a long-term planning and assessment for you. Like there should be something called trichoscopy. It means computerized assessment of your hair and scalp, so that we know, and you also know, what kind of hair you have at the back, at the donor area, the diameter of the hair, the kind of scalp you are having, the density of your scalp, then how much hair is required on your recipient area. Now this, if it is large, whether you have a required number of hair, required number of grafts at the back or not, at the donor area or not. If not, suppose you're grade 6 or grade 7 and you want a head full of hair, what kind of beard you have, whether it will be helpful for you. Also, there is something called torso donor index. The hair you have at your body, whether it can be implanted on your scalp or not. So in our center, if you come for a hair consultation, it takes not less than an hour or an hour and a half, because we want you to understand everything, right from the kind of hair you have to what results you can expect. Also, there is Saraswat Hospital App where there is PeekAI feature. Here you can upload your pictures and you will find out how you would look after your hair transplant, even before undergoing this surgery. Likewise, there are so many things which will help you understand your procedure. What questions you should ask to your doctors when you come for a hair consultation, so that things are transparent. There should be nothing which you don't know for your surgery before you actually undergo the surgery. So you should take part in the planning, assessment, and in the everything about your surgery. Then you can also ask, like when people come to us, we know that they know everything about the surgery and they know the best quality tools. So you can ask your doctor whether they would be using CTS blades or they would be using sapphire blades, also whether they would be using implanters or dwellers forceps, any other latest technique, PRP, GFC, and so many things. So there are when you come for consultation, we want you to understand everything. And there is a one more fifth very important point which I would like to tell you. But before that, let me take a few questions. Uh, Somebody is asking, I am 29 years old. My genetic baldness grade between 1 and 2. I start minoxidil without taking finasteride. Answer me. Okay, Mr. Mukulanand. You are 29 years old and your genetic baldness grade is between 1 and 2. So are you sure about your grade? Probably if you go to our channel, we have a video in which you will be able to find out your grade. So if it is between 1 and 2, you need not worry much. But if it is androgenetic alopecia and you have started minoxidil is one US FDA approved medication, the other is finasteride. You are not taking finasteride, it means either you don't want to take, but what you can do is you can stay on minoxidil, but see a hair doctor first, so that they are able to help you and assess you whether minoxidil is working for you or not. After 3 to 4 months or 4 to 5 months, you can see them again, so that you are able to take help of other medications, not only finasteride but different multivitamins or different therapies like PRP, GFC, low level laser therapy, derma roller, and so on. And this your doctor will help you because they know how much problem you have right now and then what is the assessment of your hair problem after a few months after you start medication. Okay, so I was saying, see for the credentials of your doctor, see for the experience of your doctor, see for different testimonials on the internet, and also you can ask them. Then always take part in the long-term planning and assessment, because hair transplant is not a single surgery. Hair loss is a ongoing process. If you undergo hair transplant, for that part where you have already lost your hair, you will still keep on losing hair on the top and till the crown, leaving the safe donor area, and then maybe you require your doctor again after a few years. If not for hair transplant, just for assessment and helping you in how to reduce that hair loss. Maybe you require medication, or you require a second hair transplant, or if nothing else, maybe you require a scalp micro pigmentation procedure to give you a good densification even after hair transplant. So a good hair center will have the basket of full of everything which is required for your good looks on your head. Then Mr. Anu Sharma is asking, ma'am, what is the life of transplanted hairs? So see, the transplanted hairs are actually your own hairs which are transplanted from donor side to the recipient side. So if they were not transplanted, what would have been their life at the donor side? The same would be their life at the recipient side. So in generally speaking, we can say that they will last till your old age if you do not have any other scalp problem like alopecia areata, incognito, and so on. Because the success rate of hair transplant worldwide is 97 to 98%. And if somebody is losing hair, like people who fall in 2 to 3% criteria, they are those people who are having some problem in their scalp apart from androgenetic alopecia. So like I said, alopecia areata incognito is now very, very common. Also, there are other fibrosing alopecias which may show as along with alopecia, along with the male or female pattern hair loss. So somebody is asking, hello doctor, Mr. Nasir is asking, I'm facing hair loss issues since 12 years till now. My current condition is 7th grade. My age is 35 years. Please suggest what should I do. Mr. Nasir, a lot will depend on what are your expectations for your own looks. Because you are 35, you are not, quite aged enough to have grade 7. If you are having grade 7 Norwood Hamilton baldness, then you should see your hair doctor and get your trichoscopy done, so that you know the condition of your hair, donor hair, and also we should find out how many grafts you require. What you can do is you can go to the Saraswat Hospital app and click on the PeekAI feature, so that we know your pictures, we get your pictures, then we'll be able to help you better, like how and what can be done, because your pictures are required, and then we'll be able to help out. There are different things which you can do. You can get a partial hair transplant done. You can get scalp micropigmentation done along with a low grade of density in your hair transplanted area. And if nothing is possible, you can go for a patch if your donor site is absolutely in the condition that we are not able to extract hair, and so on. So because your condition is really something to be seen, then you need a good consultation. So probably you can come for consultation if you can. Also, I am Umeshji saying I'm between grade 2 and 3. Can I do hair transplant or medication? Now, it is very important to understand that medication is for the existing hair. Hair transplant is for that area which you have gone bald. So, if you are between grade 2 and 3 and you want to cover your bald area, get your hair transplant done. But if you want to have the hair you still have, you have to come on medication. So in your case, I must say that hair transplant and medication will go hand in hand. You will have to take help of both. Mr. Rupesh Rani is asking, ma'am, can only PRP fix grade 2 pattern baldness? So I am reminded by this that very recently we would be publishing a podcast on PRP for hair. That would be on Twacha channel. And in this also I have explained very in quite detail, and now also I will tell you that PRP is a cocktail of growth serums which will help your hair to stay, not to fall. But only PRP will not help you much, because there is a certain problem due to which you are facing hair loss. If you are grade 2, it means you already are falling in the zone of androgenetic alopecia. It means there is 5-DHT hormone which is actually damaging your hair follicles. So there are 2 US FDA approved medications for androgenetic alopecia. One is finasteride and the other is minoxidil. So you should see your hair doctor and get a medication for yourself, and PRP can help you, but it will not fully help you without medication. But still you can talk to your doctor. मैम मेरी एज 17 है और मुझे बहुत हेयर फॉल है. श्री I'm sorry, I am not able to pronounce your name, but the thing is that if you are 17, then the main problem in your age, if you are a boy, is either starting off androgenetic alopecia or some nutritional imbalance. If you are a girl, then hormonal imbalance also comes into play. So you definitely need to see a hair doctor so that you get your medications and this hair fall can be controlled. Do not cry. You've written a crying emoji. Do not cry. You're only 17. Many things can be done. You will get your hairs back. Do not cry at all. Okay. Mrs. Usha Sharma is saying, ma'am, please help. This is not a gynae thing. I'm sorry. Few years back, I was diagnosed with scalp psychosis with some medication. It's a visit on Monday for sure. Okay. I'm using minoxidil 5%. Doctor recommends 0.5 milligram finasteride and dermanil once a week, and some micro and macro in nutrients. So according to the international recommendations, the finasteride is to be used in 1 milligram and not zero point 0.5. If your doctor says zero point 0.5, do talk to him and do as he says, because then you will be in capable hands. Macro and micronutrients are good. Keep taking them. Mr. Tej Bahadur is saying, मैं 18 ईयर का हूँ, मेरा हेयरलाइन रिसीडिंग हो रहा है. 18 ईयर्स पे अगर हेयरलाइन रिसीडिंग हो रहा है तो यू मे बी in the start of androgenetic alopecia, male pattern hair loss, so you need to take proper consultation and come into medication. So am I audible? Is it okay? Okay. Then one more question is, मैम मेरी फैमिली में किसी को बॉल्डिंग नहीं है, फिर मेरा क्यों हो रहा है? ज़रूरी नहीं है कि आपकी फैमिली में किसी को हो तभी आपका हो. इसको बोलते हैं हेरिडिटरी. और अगर आपसे शुरू हो रहा है तो जेनेटिक है, आपके में है. अब आपकी आगे वाली प्रोजेनीज में हो सकता है. और शायद ये एंड्रोजेनेटिक एलोपेशिया है क्योंकि टेम्पल एरिया थोड़ा थोड़ा पीछे गया है. व्हाट्स माय प्रॉब्लम? द प्रॉब्लम इज एज यू सेड मे बी एंड्रोजेनेटिक एलोपेशिया, but you need to see your doctor because it is something to be seen, and then you can be told, or you can post your pictures on Saraswat Hospital PeekAI app. मैम सब लोग बोलते हैं मेच्योर हेयरलाइन है. हो सकता है अगर शुरू से है आपको तो मेच्योर हेयरलाइन, अगर अभी हुआ है तो फिर आपको एलोपेशिया स्टार्ट हो गया है. Ma'am, if someone suffers from scalp problem like psoriasis or subderm, how can he apply minoxidil? Because even if it is under control, it can recur in future. Yes, you're right. Minoxidil can increase seborrhea or psoriasis. It is known to do that. But now there is oral minoxidil also. So आपको जिन डॉक्टर ने मिनॉक्सिडिल बोला है उनसे आप बात कर लीजिए, अपना प्रॉब्लम भी बता दीजिए, एंड देन दे विल बी एबल टू हेल्प यू. बिकॉज सी, डू नॉट टेक ओरल मिनॉक्सिडिल ऑन योर ओन. इट हैज़ गॉट इट्स ओन साइड इफेक्ट्स विच शुड बी टेकन वेरी सीरियसली. तो आप बिना पूछे नहीं लेंगे. कितना लेना है, कब लेना है, क्यों लेना है, ये आप अपने डॉक्टर को डिसाइड करने दें और फिर आप लें. ज़रूरी नहीं है कि आप ले ही लें, है ना? ठीक है. सो लेट मी नाउ क्विकली रिकैपिचुलेट व्हाट आई सेड. आप अपने डॉक्टर की डिग्रीज देखिए, क्रेडेंशियल्स देखिए, उनका एक्सपीरियंस देखिए, पेशेंट के टेस्टिमोनियल्स देखिए, लॉन्ग टर्म ट्रीटमेंट प्लानिंग कीजिए उनके साथ. हो सके तो आप PeekAI ऐप यूज़ कीजिए सारस्वत हॉस्पिटल में, अपना बिफोर आफ्टर देखिए, लेटेस्ट टूल्स देखिए आप कौन कौन से यूज़ करेंगे. हम बेस्ट क्वालिटी टूल्स है. मशीन, okay. So the machine which we should be using as a doctor, I think, should be a machine which has a counter in it. So at Saraswat Hospital, we are using a machine in which we have the punch counter. When we take out, harvest the grafts, the machine shows. So you also know how many grafts we are punching. Then best quality tools is okay. Now coming to the final, but one of the most important things you should see when you're going to a hair doctor. See for your team. The team should be permanent. You should see same smiling faces years after when you get your hair transplant. So these people are those people who know their job, who are skilled in their job, who are doing their job for so many years. Everybody has got allotted, assessed slot. This they would be doing, and they are doing it for so many years. So they are skilled in their job. The error, the probability of error in such cases is very minimum. And this is the same team who has been giving consistent results for a long number of years. So a permanent team who can hold your hand after your surgery is very important. Let me take a few quick questions and then it is time to wind up. प्रथमेश सिंह, मैम मिनॉक्सिडिल और फिनेस्ट्राइड के कितने साल तक बाल बचेंगे से कितने साल तक बाल बचेंगे? प्रथमेश, द थिंग इज दैट मिनॉक्सिडिल एंड फिनेस्ट्राइड are medications which help you in your hair loss, but body tends to be immune to medication also after many years. So we know patients who have been using it for past 20 years. हमने जिन पेशेंट्स का 2009 में हेयर ट्रांसप्लांट सर्जरी किया वो अभी तक लगा रहे हैं, अभी तक यूज़ कर रहे हैं. सो इट मीन्स 16 years तो हो गए. सो लॉन्ग टाइम they have been case reports on patients using this for a long time. Sometimes body says, no, I don't want to now respond to this medication, so the hair will fall. But many a times the hair remains. Okay, so don't lose heart. Keep using the medication. What are the results of microneedling with minoxidil and finasteride? The results of microneedling are, it depends on the center, or if you are doing the microneedling at home, we have a video, proper video at Saraswat Hospital channel only by Dr. Satya Saraswat, the role of derma rollers in hair loss. So do check it out. You will get the so many answers for your microneedling. आपका क्लिनिक कहाँ है? It's in Agra. It's Saraswat Hospital Agra, उत्तर प्रदेश, इंडिया. मैम मिनॉक्सिडिल कितने साल तक काम करेगा? अगेन ओके, मिनॉक्सिडिल it works for a long time. You need not worry. If it is not working, then you have to see your doctor. So I think that brings us to the conclusion of today's live. Is it okay? So if you have any more questions, do let us know. And next week we'll be here, same time, same channel, with a different topic. Okay, so if you want to tell your topic, your choice of topic, do let us know. Just one more question, quick question: topical finasteride side effects. So again, Mr. Saurabha R. Gupta, we have a very good finasteride side effects video on Saraswat Hospital channel. Because of lack of time here, I'll not be able to take your questions. So let me just wind up. Do check this video on Saraswat Hospital channel and you will find all your answers, I'm sure. If something is still lacking, do write in the comment section. Thank you so much.